the symptoms. But let me straight away go to Dr. G.C. Khilnani, Professor Chairman, PSRI, Institute of Pulmonary Critical Care and Sleep Medicine. Thank you so much, sir, for joining me. There are two issues here, sir. One is the issue of science and health, and another is the issue of community health in a country not allowing the leading global minds of medicine to access what is happening, sir. And I open the floor
So,
to you.
yeah, thank you very much. First, I would like to inform everybody that this Meta-Neumo-Virus is not a new virus. It was first found out in 2001. And if you talk about hospital admission in routine in United States and other countries, 10% of the patients who are admitted with pneumonia actually have Meta-Neumo-Virus, but it is rarely detected. Like the coronavirus, like COVID virus was a type of coronavirus, and coronavirus has been there for ages. Now let's understand what is this metapneumovirus. This virus generally affects like young children and elderly very seriously. It usually occurs in winters. It is just like any viral illness, like presenting with cough, fever, sore throat, running nose, fever, and self-limiting. By the age of 5 years, 90 to 100% of children are already infected. So it's not something which is rare. But in patients who are very young and those who are elderly, those who are immunocompromised, it can take a lethal turn and patient can have severe pneumonia and in the ICU. If you talk about data, 10% of patients in the hospitalized pneumonia have metapneumovirus, and 4 to 6% of children coming to the outpatient have the same virus. But what is important? Important thing is that like coronavirus was also not uncommon. It is well known and well described in literature. Similarly, this virus is also not something rare. But only thing is that strains keep changing. These RNA viruses are notorious for mutations, as we saw in the coronavirus. The novel COVID-19 came and caused havoc. Unless it is detected and protected, this can spread like wildfire. The mode of transmission is same, like by fomites, that is by
Professor,
touching.
my question to you is, do mutations over a course of time can create higher virulence? That's one. And secondly, if the minds in medicine are not given the chance to study from where they originate, can it hamper the ability to protect one's population? Like India is on alert now. We know what's happening in China. And if you recall, sir, even when the COVID-19 was being detected and reported, and I was in Dubai and the programs were being cancelled, the China had put a curtain, iron curtain, on information going out. So you have
Absolutely.
also a geopolitical ramification. They are not like
Absolutely.
India, open, sharing medicine, sharing vaccine, helping poor countries.
So, absolutely, I totally agree with you and understand. And what I want everybody to understand that why COVID caused greater havoc, because for a very long time China concealed it and people kept traveling before everything was stopped and went into lockdown. And the question that you asked, that is RNA virus, they are notorious for mutation, and every mutant has different characteristics. What happens that the mutant which is more virulent and more transmissible, like we saw delta waves in COVID time, this particular strain was more transmissible and more virulent and more lethal. So similarly, any RNA virus or any virus for that matter can have different kind of virulence and different kind of lethality as well as presentation.